So, hi guys, welcome to the masterclass on post-burns neck contractures. We are in the discussion segment of it, and in this part, we will discuss the post-operative considerations. So, I believe you have seen the first two videos of the pre-operative considerations and the intraoperative considerations of post-burns neck contracture. We will be discussing with the post-operative considerations in this particular video. Now, coming to the duration of splintage in the post-operative period, it is universally accepted, there is no debate about it, that you need to give splints to a neck contracture on release at the table, and you need to continue the splintage for a prolonged period of time. But how do we objectively assess the need for XYZ duration? So what we commonly do is we tend to tell the patient that you need to wear the splintage for 9 months or 1 year or 1 year or 1.5 years or so. But what is the objectivity in that? By objectivity, I mean, if we say 1 year, can it be 364 days? Can it be 1 year, 1 day? So there is no objectivity as such. So how do we assess the objectivity? We define a certain criteria. For example, if the patient has stopped wearing splintage, we take certain measures of the maybe cervicomental angle, and we follow up the patient. If the patient has stopped wearing splints today, after 1 month we again measure the same angles, and if the angles are contracting, if there is some evidence of contracture of neck again, then we restart the splintage. So how do we objectively assess? Coming to the point, we after a specific time frame, we measure the angles, and assess if there is some amount of recontracture which is happening, and if it is happening, then we continue splintage. We continue it for a time when there is no recontracture happening.